Leading medical schools are finding a new trend: pandemic weight gain. Most folks gained between 3 and 15 pounds during pandemic closures. I think a lot of us have experienced that. And while weight loss might be a goal this summer, Dr. Jeffrey Eisen, the Chief Medical Officer for Multicare Behavioral Health, is here to help us with some smart ways to manage the mental health side of weight gain and loss. Good morning, Dr. Eisen.
Good morning. Thank you for having me.
Yeah, thanks for being here. Okay, let's start off with this one. Why do you think the pandemic led to weight gain for so many of us?
During the pandemic, we all faced greater concerns, and many have coped with increased anxiety and depression. And weight loss or gain can be manifestations of these extremely stressful situations. For me, I gained 10 to 15 pounds during the pandemic, and this occurred for a number of different reasons. I had a significant change in my routine. I faced much higher stress as a frontline mental health worker during 2020, and I learned to bake bread. So this is not unexpected.
Yeah, some of those hobbies kind of even play into it. I'll admit it too. I've gone through that as well, gaining some weight during the pandemic, and you just have to kind of learn to cope with it or figure out what your plan is for what you want to do. And in some ways, we're in this period of transition. Things are changing for the better, but we're also not all the way back to normal yet. So how can we live with our bodies when we're feeling so different or even uncomfortable?
Yes. My advice is first and foremost to cut yourself some slack. We've all been through a difficult and dark time. And as we resume more normal activities and we get vaccinated, we will have the ability to be more intentional about this. Also, if we focus on the good and other things we have gained during this time, that can be very helpful, whether it's gaining a new appreciation of friends and family or having taken on a new hobby.
What advice do you have for people who are looking to lose some weight?
So my recommendation is to start with one simple goal: going for a daily walk, getting more sleep, all good options to feel better. I'd also say take advantage of the best weather of the year, which is coming soon. And if you're struggling with anxiety and depression, I'd consider reaching out for support. Multicare offers mental and physical health care at a number of clinics, and we and other healthcare professionals can help.
And another question that I had was just, when we talk about weight loss, when some people go through the process of trying to lose weight, it can be unhealthy mentally for them. They get into this cycle and, there's talks about eating disorder, stuff like that. So do you have any advice for someone that wants to lose weight, but to do it in a way that's making sure that they stay, mentally healthy through the whole thing as well and not getting into those traps?
Yes, absolutely. For individuals looking to lose some weight, but wanting to do it in a safe, healthy way, I always recommend reaching out to a primary care physician or a nutritionist and doing some intentional thinking about the right ways to go about losing some weight. And as I mentioned before, opportunities to start very simply and just getting outside and enjoying the good weather and enjoying family and friends once again in person are great ways to get started.
That can also just be good for your mental health too, getting out there, feeling some sunshine on you, maybe seeing some other people, which is great. Dr. Jeffrey Eisen, the Chief Medical Officer for Multicare Behavioral Health, thank you so much for being here with us today. Some great tips that you gave us.
Thank you.